welcome to this instructional video on how to use and inject insulin using an insulin pen device. This is an insulin pen. It contains a cartridge of insulin.
The insulin in the pen may be clear or cloudy in color, depending on the type of insulin you are prescribed. Please check with your provider regarding the type of insulin you will be prescribed.
A dial to set your dose, and it uses disposable needles. It is important to store your insulin pen properly to ensure it works effectively. Unopened pens should be kept in the refrigerator, not the freezer, and are safe to store until the expiration date on your insulin pen. Once you've started using a pen, you can keep it at room temperature for 28 days or until all the insulin in the pen is used.
If the insulin you are prescribed is cloudy or milky white in color, make sure you gently roll the insulin pen in your hand to evenly mix the contents. Never shake or agitate the pen to mix the contents.
Never use a pen that's been frozen or exposed to extreme heat. Before we start, we make sure you have your insulin pen, a new needle, and 2 alcohol swabs, and a sharps container nearby. First, wash your hands with warm, soapy water. It's important to ensure your hands are clean to prevent any potential infection at the injection site. Remove the cap covering the insulin pen. Take 1 alcohol swab and gently clean the top of the insulin pen. Take the insulin pen needle and remove the paper tab on the bottom. Place the insulin pen needle on the top of the pen and turn it clockwise until the pen needle tightens. If you over-tighten the pen needle, it may loosen and need to be tightened again. There are 2 caps on your insulin pen. First, remove the outer cap and put it aside. You will need this after you are finished. Then, remove the inner cap and discard it. Now we need to prime the insulin pen. This ensures the insulin flows properly and that any air is removed. Turn the dose dial to the number 2 on the insulin pen. Hold the pen with the needle pointing upwards and press the injection button. You should see a small stream of drops of insulin. If not, repeat this step until you do. The dose dial should return to 0 once you have primed it successfully. Turn the dose dial to the number that matches the insulin dose you are taking. If you are unsure of how much insulin you should take, or you feel uncomfortable taking the dose of insulin prescribed, please consult with your healthcare team before making any changes. Now you will need to choose your injection site. There are 4 areas where insulin can be injected: the back of the upper arm, the abdomen at least 2 inches from the belly button, and the upper buttock and the top of the thigh. Clean the area with an alcohol swab and allow it to air dry. Avoid injecting into moles, scars, or areas where the skin is broken or irritated, as insulin may not absorb correctly. Holding the insulin pen at a 90-degree angle to the injection site, push the needle into the skin and press the injection button at the end of the pen to inject the insulin. When the dose dial turns to 0, continue to hold down the injection button. Count slowly to 10 before removing the needle. This ensures all the insulin is delivered. After injection, remove the needle from your skin. Use the clear outer cap to place back on top of the needle. When it is firmly in place, rotate the clear outer cap counterclockwise to loosen the pen needle. When the pen needle is turned loose, it will lift off the top of the insulin pen. Place this used pen needle in a sharps container or a hard plastic container. Place the insulin pen cap back on and store safely until the next injection. You can find Sharps container disposal help at safeneedledisposal.org.
Always place your needle into a Sharps container or a shatterproof puncture-resistant plastic container with a screw on top. For example, a washed-out bleach or laundry container. The top should be tightly closed and the words Medical Sharps written on the container. And then follow your local sanitation department rules. Thank you.